Hey, hello, how you doing? Hey, we want to thank you for joining on Allergy Insider, inside the mind of the allergy expert. So today, my name is Dr. Derrick Varner. I'm a practicing PA here with my manager and colleague.
Hi, I'm Tara Bruner. I am manager of clinical education for Thermo Fisher, but I'm also a practicing PA. So we are here live at a medical conference. And at this really exciting time, this happens every year, and it's called the American Academy of Asthma, Allergy, and Immunology. If I got that right. We call it the quad.
Yeah, the quad. But guess what? It is something unique this year. It's just not the Quad-I that you mentioned, but it's a joint conference, right, with the World Allergy Organization, right, in 2025 here in what? Lovely city?
San Diego,
California.
Exactly. It is nice to be here. I live in Arkansas, so we've had some cold spells, and this weather is nice.
Yes.
But we're talking about climate change.
Yes.
So that's the overall concept and theme of this year's message. So we have thought leaders, so specialists, researchers, allergists. Maybe your local allergist has attended this meeting or is very familiar. They put out journals, they communicate throughout the year, but they come together this time of year to really share these ideas. So we also have industry here,
yes,
which is diagnostics, maybe it's healthcare, such as medications, pharmaceuticals, all talking about how can we improve patient care. And so we have some really big highlights this year of conversation. So
yes,
we are excited because today is the first day of this. It'll go throughout the weekend. But what are some of the topics proposed for this conversation sessions?
So some exciting topics. They're going to talk about some things like angioedema, that's swelling in the face and the mouth, right, when someone comes in contact with a particular trigger. They will talk about anaphylaxis, EOE, something called eosinophilic of the esophagus. They're going to talk about some immunological rare diseases like primary immune deficiency, things of that nature, right? Also, they're going to talk about, Tara, I'm super excited about, the international update on food allergy. That's a hot topic because everybody likes to what? Eat. Everybody likes to eat, right? Yeah. So getting an update. And another interesting topic, I thought it was funny being in California, but they're going to talk about cannabis.
That's appropriate, isn't it?
Yes. That's a hot topic. So they're going to be talking about a myriad of things that entails allergy, immunology.
Right.
The whole spectrum, right?
Going back to different topics, really food, many are affected by food, or maybe they think they are. They eat something and they're not quite sure. You know, something's gone wrong, whether it's a rash, whether it's I feel weird, maybe my mouth itches, or maybe and you get fearful of foods.
Oh, yes.
And so really the conversation here is what is a true allergy and what can we really do? So there's some really big, we talk about conversations here is therapeutics or medications.
Yes, exactly.
There's some really big ones on the market or that are getting approval for things like food allergy.
Yes.
So peanut, maybe, and they're called biologics. They're a newer form of therapy for other disease states, but actually are working very well for food allergy and have been used for asthma too.
Exactly.
So again, what is late and breaking in the way that we can communicate this and treat patients?
Yes.
Yeah,
I agree with you. There's a lot of things. You know what? There's another product that I was thinking about when those patients or you maybe or a loved one experience that life-threatening reaction called anaphylaxis. Yeah. You have to give that injection. That's subcutaneous, autoimmune, or epinephrine, right?
Barbaric.
So, yeah, it feels that, right? So there could be some anxiety, some apprehension. But there are some new products that's out here that may be displayed from some of the pharmaceutical, where you can spray what?
It's right in your nose.
Spray it in your nose. What?
So new methods of treatment, and really this is great. So I love this Instagram Live. We want to offer conversation. So we have a question that's come through, and the question is, will you be talking about what causes these food allergies in our children? And I want to answer that. So one of the things, this climate change, how is it changing? And I'm going to use some pretty technical words here, but the microbiome. So essentially, our bodies live in this homeostasis. This is another big word. Everything's equal, everything's moving as it should. But the microbiome are these cellular and whatever is external and how they kind of communicate. So our microbiome our immune system.
Yes.
And so the microbiome is changing with this climate. And so that's a great question. So we know right now that in certain people who have what we call sensitization, or maybe their body recognizes a particular food for a reason, their body sees that as foreign. And it may be something where it just stays, pretty we call benign, or not so serious, where it just stays localized, where your mouth kind of itches. But then you have what you just mentioned, which was anaphylaxis, where something can just overtake the body if you ingest it, and your body just goes berserk and causes things like maybe a full body rash. At worst case scenario, low blood pressure, maybe you have difficulty breathing, things like that. And so the reason for this is absolutely discussed at these meetings, is we understand that pathway where your body eats a food and on an internal level just goes a little berserk. But how can we understand that more is really what we're here at this meeting to figure out and share ideas with. So what's causing it? I guess the other question alongside, I'm going to tag along with it, is why are we seeing more of it? And Dr. Derrick, I'm going to ask your opinion on that. Why are we seeing more food allergies right now?
I think that's the million-dollar question, why, right? And there's a lot of hypotheses out there, a lot of reasons as to why. It could be genetics, right? It could be immune deficiency. It could be the environment, climate change. So there are some things that are changing, right? And so that's why we're here, right? We got the global thought leaders, researchers, to answer that question. And especially, right, because I think the question was involving children, right? Sometimes we know that the immune system changes, right? They may grow out of it. They may develop a tolerance so they can enjoy those foods. But those ones that can't, there's a lot of therapeutics available, biologics, not only oral ingestion, what we call sublingual or subcutaneous, but there's epicutaneous, meaning that there's something you can put on your skin to desensitize. Well, there's a lot of great information and research going on.
And it's not just therapeutics. We've got to answer. We have this, okay, I eat, that cause and effect. I eat food and this happens. But testing is so important.
Yes.
There are different methods to be able to identify a true allergy. And a true food allergy means you've eaten something and you've had a clinical outcome. And it can be more than just an upset stomach. It can be allergic in nature. There can be some intolerances, but we're really sitting in the world of allergy right now. So testing help us, that history of that abnormal, along with the testing, neither one of them, are really conclusive alone. However, if you can take that clinical history that's reproducible, happens time and time again, and testing.
What type of testing? What would you say? Just touch on that a little bit.
Well,
what testing is available, options that your primary care provider or the specialist may have? Can we talk about that just a little bit?
So there's skin prick test, where they actually take a little bit of that allergen, kind of barely introduce it into the skin and watch a reaction. There's also a simple or convenient blood test that can do that, and we are very familiar with that.
Oh, yes.
But that being said, this is a conversation to bring up with your healthcare provider. If you think of food, or maybe outdoor allergens, we're here in respiratory season.
Yes, we are.
That can be a problem too. I do want to just briefly go back to one thing that you said was, can this be outgrown?
Ooh.
And the answer is, a lot of times they can. The numbers can vary with particular foods, but in some foods, kids can outgrow about 80% by the age of 12. So identification of that and understanding what's the opportunity to outgrow is what all of us want to know as parents, and what do we need to do lifelong. So again, testing is very important to understand potential to outgrow. So that was one of the questions that came through too.
Right.
So again, I want to continue with some of this dialogue. We've got some really great dialogue.
Yes.
So another one is the microbiome in moms. That's a good question. Let me just take you. So yes, there's much research about maternal and allergies. Can you transmit those? It's unlikely. There could be some genetic issue. We often worry as moms, is breast milk going to pass through and be a problem? But when we talk about research, I'm going to take us back a few years, if that's okay, just for a quick minute, because I'm sure at one year this was a hot topic. There was a study, an article, medical literature, which is highly scrutinized and then published, that validated there were patients in I believe it was Israel, they weren't saying peanut allergy, like it was the United Kingdom or the Americas, and they wanted to know why. And we had thought for years and years that peanut allergy needed to be you wait to introduce it to your child for 2 years. Well, that study conclusively identified that Israel didn't have that peanut allergy because they introduced it early. Peanut.
Yes.
So it's conversations like that change how we look at foods, and so as we speak about the microbiome and climate change, that's what we're doing here,
Sure.
and that's what everybody's come from all over the globe to discuss.
Exactly.
So so some really great thought leaders, and I'm excited to see what might be a pivotal change in the diagnosis and the treatment of allergy diseases.
So like Tara was saying, it's all about advancing the science, advancing the way we practice to help the patient, you, at the end of the day. So that's what I'm thrilled about too. And this is just the very first day. It's going to go all the way till March the 3rd, Monday. A lot of great information, a lot of great literature, a lot of great research, so we can learn, so we can help take care of the patient at the end of the day.
Absolutely. A lot of great questions came through. We have some information on allergyinsider.com that can help answer some of these questions. We want to continue this dialogue. That being said, we want to go ahead and conclude because we've got sessions to go to. Yes. We want to absorb all of this information and translate it to you. But we want to thank you for joining today. Again, join us next month as we continue this Ask the Insider.
Yes.
And we have a special guest in March. So again, Derrick, I want to thank you. I want to thank our audience. And I also want to say, if you have any questions, please reach out. We care about you, the patient, at the end of that. So,
Until next time.
Until next time.
We'll see you later.
Thanks
for joining.
Bye-bye.